uh, job of engaging interns. We even had some postgraduate interns over the years. And every year we try to link the interns with activities that are meaningful to them, hopefully lead to some skill development, connect them with professional opportunities. That's our goal. And every year we are looking for new interns who are, after the ones who are graduating and moving on with their career, can come in and take on some new tasks. Kara is the one who is coordinating the intern program, and she also does some professional development activities. We also provide access for the interns to our faculty, and so it's really a nice process. We feel very fortunate to have them. They all bring unique skills and strength to the program, and we have developed some wonderful products with the help, and without their help, these products would have not happened. Today we will hear from three of them. We have a fourth who, as Kara mentioned, was unable to join. And you will see how diverse their task list is. And hopefully you will get excited of some of the projects that they will share. So I wanted to thank them for their amazing contributions this year. And I will let Kara introduce them before they present.
Thank you, Borshika. Yeah, I've had the pleasure of working with these incredible interns for a number of years now, and so I'm really excited to be able to introduce them. I've worked with Rosmina since March 2023. Rosmina received her Master's of Public Health candidate at Geisel School of Medicine at Dartmouth, with a dual bachelor's degree in global health and psychology from UC San Diego. Her extensive experience in public health research includes work with Karen Fortuna, exploring risk factors and peer support mechanisms, and contributions to the Dartmouth Institute Co-Production Lab's AWARE protocol, which focuses on optimizing antipsychotic treatments for youth. Rosmina has also supported global health initiatives like the Access Cervical Cancer Project in Nigeria, and collaborated on pediatric tuberculosis guidelines for Cambodia. She actively engages in health policy and program development, driven by a commitment to equitable healthcare access and sustainable community health practices, most recently taking her to Iran. Her interest in implementation science stems from a desire to bridge research and practical application, ensuring that evidence-based interventions are effectively adopted within diverse healthcare systems. Hesti Modi will be our second speaker. Hesti is a clinical research professional with a master's degree in clinical research from UC San Diego. She has over 3 years of experience in public health, project management, and clinical research coordination, working on projects aimed at improving healthcare access for BIPOC, refugees, and underserved populations. Currently, Hesti is an intern on Project Weave, where she supports the development of recruitment strategies and database programming to enhance preventative care and vaccine uptake in marginalized communities. Her research interests span across women's health, particularly in OBGYN and mental health across the lifespan, as well as understanding the impact of adverse childhood experiences on long-term health. Hesti joined the Dissemination Implementation Science Center, or DISC, to gain hands-on experience in adapting healthcare interventions to better meet the needs of underserved populations. Through this internship, she's building practical skills and applying implementation science principles, experience that aligns with her long-term goal of pursuing a PhD in health services research or public health. Ultimately, Hesti aims to bridge healthcare interventions and real-world impact, focusing on creating equitable health services for vulnerable communities. Hesti's been with the DISC since January 2024. And our last speaker is Isaac. Isaac Bouchard is a graduate research intern. He received his BS in Psychological and Brain Sciences with a minor in Applied Psychology from UCSB. He is interested in enhancing the accessibility and efficacy of evidence-based practices for undocumented and refugee youth through partnerships with schools, healthcare providers, and community agencies. Isaac is particularly interested in adapting interventions and implementation strategies to fit settings that serve these populations. Currently, in his first year in the clinical psychology research with a research emphasis master's program at California State University Northridge, and Isaac has been with us as a DISC intern since October 2023. So I am going to stop sharing and hand it over to Rosmina to start off the presentation.
Hi everyone, nice to meet you. And thank you for coming today. All right, 1 second. Great. Are you guys able to see my screen? Yes. Okay, great. Well, nice to meet you, everyone. My name is Rosmina. As Kira mentioned, I have been a DISC intern since the year that I graduated from UCSD, and I carried on being an intern throughout my MPH program. So just a little bit about me. I think Kira's summary covered a lot of things, but I just beyond that, I do love baking. Right, there's a cake that I made. I do love cats, and that is a picture of my cat with my MCAT book, unfortunately, which is what I have been doing since graduating from my MPH program. I have been doing a lot of research since graduating, but also throughout my master's program at Dartmouth. As Kara mentioned, I have been able to take the skills that I learned from this internship and apply them through numerous research projects. Specifically, I've looked at risk factors and protective factors with SMI patients in rural parts of New York. Among the older adult population, which was a very big learning experience. And I have been able to translate that research into a project that I received a grant for and went to Iran for a few months to also look at risk and protective factors within SMI patients there. I am Iranian, so this was a kind of a very big opportunity for me, being able to go back home and apply what I have learned throughout my master's and bachelor's program there. And then beyond that, I will be talking to you about one of my first experiences within this internship, and in my opinion, one of the most important ones because it was probably the biggest learning opportunity that I received. So more about that, I was able to contribute to our course that we have with Borshika and Aaron and everybody else. And I was able to kind of engage in teaching about dissemination implementation with the goals of the course being that building capacity for DISC education, specifically now that it's a growing field with new grants coming up and also it being a major component of research everywhere, whether that is in rural communities, which is something that I experienced living in New Hampshire, or abroad throughout global health. Also increasing education about DNI strategies and the new upcoming strategies, which there are so many of them that I can't even keep up. And also creating space for guest speakers. I think that even the monthly meetings that we have is a great opportunity for people who are doing research to just come and talk about how the field is growing, and the course was an extension of that. And the opportunity for students to be able to write their R21 proposal and get feedback on it and be able to share it with their classmates, which we'll go into more detail about that, but also to familiarize students with using measures that in other public health studies and being able to translate that in their careers, wherever that is going to take them. And providing a foundation of theories, which I will say this was the most important part for me because I did not have that much of a background about implementation science and what it actually meant and the different frameworks and how to kind of incorporate those into different types of research. So being able to learn about that as an intern was a very big and impactful opportunity for me, and I imagine it was the same for the students. So, in terms of our class, there were only 7 students, which might not seem like a lot, but I promise you the 2 hours of class, I believe that we had, everyone spoke up and was able to kind of communicate. So we had students that were doing their master's, Hetzi was actually one of the students. And we had students from UCSC and DSU programs, um, people from School of Medicine, and each one of them truly brought in a new perspective and applied that through their proposal and the conversations that we had in class. So, as the teaching assistant of this course, I was able to kind of sit back and observe, but also to learn. And the students in this class came from very various backgrounds and interests and where they wanted to take implementation science. And I think that's what makes implementation science very special. It's the fact that you can apply it to many different things. And as you can see on this little diagram, this was the first thing that we did in class, and it was students bringing in kind of their experience and where they would want to take the strategies that they learn. And a lot of these also came up later on in their R21 proposals as well. And I found out to be interesting as an undergrad who didn't even know what an R21 proposal was at that time. So my responsibilities in the beginning included writing the course proposal for distance education, which, like this seminar, I think it's important to give access to people that are not just in one place. And the course truly highlighted that, even though a lot of people were still in California. Obviously, my tasks included just your usual teaching assistant tasks, being able to take attendance and ensuring that the students were engaged, but also updating assignments, which allowed me to go and snoop in the Canvas course and to learn. And specifically, Erin always and Borshika like really highlighted me being able to read through the documents as well, and sometimes even ask me questions that about what I thought about the class, and that truly made me engage more with the topics there. And again, my takeaways from all of this is engaging in D&I research and the power of this growing field. And again, I was able to take the skills that I learned and apply them not only to rural areas, but also countries abroad. And again, after this, I went on to engage in more research with as a disc intern for the later year. And clearly, this was a big foundation, which is why I wanted to highlight it, and made me more interested into the field. And it is going to be something that I'm going to continue to apply in my own research, but also future talk about it. And yeah, so that's about it. Thank you for listening.
Thank you, Rosemina. That was such a wonderful presentation. We can pass it on to Hesty. I figured we can save all the questions for after the presentation. So Hesty, I'll go ahead and hand the microphone over to you.
Well, thank you so much. Okay, is my presentation visible? Okay, just a minute. Okay. So, hi everyone. My name is Hetzi, and I'm an intern on Project Weave that aims at increasing vaccine and preventive care uptake among BIPOC and refugee communities through care coordination and mHealth outreach. In today's presentation, I'll talk about Project Weave, the research strategies we are using, the implementation science frameworks, and the approaches that guide our work, and the key lessons that I have learned while working on this project. So this is all about the agenda, and I covered that in my previous slide. A little bit about me. So in my role, I have developed the almost entire database in the REDCap. I have programmed automated mHealth messages to reach out to participants who were randomized to the intervention group. And I also track all the adaptations we make as the project progresses to ensure that our approach remains responsive to our participants' needs. I also create reports to support care coordinators in effectively following up with our participants. And like Rosamina mentioned in her presentation, my journey at DISC began with an implementation science course, which was taught by Dr. Rabin, Dr. Stadnik, and Dr. Ahrens in the spring of 2023. And this course highlighted the importance of adapting interventions to make them accessible rather than simply creating new ones. So while my master's program in clinical research at UC San Diego, it emphasized on a top-down approach to health equity or public health research, I realized that meaningful change requires rethinking how interventions can be implemented in underserved communities. And this realization inspired me to join DISC, where I am gaining firsthand experience in bridging health interventions and real world impact. So I truly believe that this internship is a key step towards my goal of pursuing a PhD in health service research or a PhD program in public health with a focus on implementation science. And it is through Project Weave that I'm learning to apply implementation science principles to overcome barriers, to adapt interventions, and to make health services more equitable. And like Rosamina also mentioned, this is an experience that will be invaluable in my future career, where I envision myself working to improve healthcare access for underserved populations or women, at-risk women, like Kara mentioned while introducing me. So I'll now introduce you all to Project Weave. So Project Weave focuses on bridging critical healthcare gaps exposed by COVID-19, which disproportionately impacted BIPOC and refugee communities. Despite the availability of the vaccines, the vaccination rates remained low in these populations. And this was mainly driven by hesitancy, misinformation, and access barrier. So this Project Weave, it aims to address these challenges by engaging the community in designing and delivering culturally tailored interventions. So through this approach, we hope to improve not only COVID-19 vaccination rates or flu vaccination rates, but also broader preventive healthcare access, which would ultimately foster health equity in underserved communities. Let's talk about the research strategies, the study design, the implementation science framework which guided it, and what are the strategies that we are using. So this study, it employs a hybrid type 3 effectiveness implementation design, which is unique in assessing both health impact of the intervention and the process of implementing it effectively within the community. The adaptive smart trial, which I'll be explaining more in the next slide, it allows us to modify our approach based on the participants' responses. So for example, participants who aren't fully engaged by mHealth outreach can receive additional support through care coordination. So we also use PRISM framework that has guided a lot of things, or which has guided the study. So PRISM framework, so using this PRISM framework, we address different levels of context from individual needs to larger health policies to ensure that strategies are sustainable and impactful. And we have three key implementation strategies that support our approach. The first one are the community weavers, with whom we co-create solutions with local input. The second one is mHealth messaging or outreach, which helps us to provide accessible health information or text message reminders to the participants if they are missing some of the behaviors, like some COVID-19 vaccines or flu vaccines or other preventive care healthcare services. And then we have care coordination or care coordinators who offer personalized support for preventive services. So together, these strategies, they help us tackle healthcare access barriers and promote lasting engagement in underserved communities. Okay, so like I mentioned in my previous slide, now I'll be talking about the smart design that we are using in this study. So this figure, it illustrates the smart design of our project Weave. So participants are first randomized into two groups, one receiving mHealth outreach, example, text reminders and educational messaging, and the other receiving standard of care. So after the first 4 months of the intervention, their response is evaluated. If we have non-responders, then they are re-randomized into either mHealth outreach and care coordination, which would include personalized follow-ups, or a continuation of the existing intervention. Responders, they continue in their original arm. So this adaptive design, it basically ensures that the strategies, they are tailored based on the response patterns of our participants. And as of now, we are nearing the end of the first stage of intervention phase, which is depicted over here in this picture. So I'm really excited about the progress. This slide, it talks about the mHealth outreach system that we are using in Project Weave. So while this image is from the published protocol, I have included it here to provide an overview of how our messaging system works. We have made a few adaptations to it, but I just wanted to give you all an idea about what it is exactly about. So in our project, Twilio is integrated with RedCap, which collects participants' contact details and other screening details. Health messages are co-created in Spanish, Arabic, and Vietnamese, and they are programmed directly within the RedCap. So these messages, they are automated based on a logic in the RedCap database to ensure that the participants receive targeted and timely messages via Twilio. Although this image mentions Salesforce CRM, we are not using Salesforce as far as I remember. Instead, all the tracking and management are handled through RedCap and Twilio now, and this is making the system more streamlined and aligned to our project's needs. Now, let's go on and dive into my key takeaways. So the first key takeaway was navigating real-time feedback integration in multi-component design. So the study's adaptive design aimed to incorporate participant feedback, but I found that integrating real-time feedback into a structured multi-component intervention was tricky and challenging. So despite having regular feedback channels and community involvement, aligning feedback quickly to adjust recruitment and messaging was more complex than expected. And feedback often arrived after strategies were set, which would sometimes cause delays in adapting. So as a result, some suggestions took time to implement, limiting their immediate impact on the recruitment and engagement. And I think, in my opinion, this slower adaptation, it could have affected participants' sense of being heard and their commitment to the study. But looking at the progress in the last few months, I really think that after adapting our strategies according to the participants' responses and need, we have been able to engage them better in our study. The second key takeaway was how to balance protocol fidelity with real world adaptations. So one key challenge that we encountered was balancing the original study protocol with the need for the real world adaptations. For example, while the protocol relied on care coordinators at our partner San Ysidro Health's network for recruitment, their workload and competing priorities created barriers to participants' enrollment initially. But then to address this, we had our wonderful community weavers jump in, and they were trained to align with the SYH practices and support recruitment. So while this adaptation improved recruitment efforts for sure, it also added somewhat complexity, in the sense that it required more time for training and coordination. So my major takeaway was that I realized that even with strong implementation science frameworks and community input, balancing fidelity and flexibility is nuanced than expected. The last key takeaway was that sometimes we underestimate the needs for broader education on, let's say, vaccine science or preventive care services and misinformation. So, key challenge we faced was relying on culturally tailored messaging to reduce vaccine hesitancy, assuming that addressing these cultural factors would be enough. This approach, in my opinion, and as per my understanding, it somewhat underestimated the impact of misinformation and broader skepticism about vaccine science. So, misinformation specific to the community, such as fears about vaccine safety or distrust in medical institutions, they persisted and limited the effectiveness of cultural messaging. While these messages were aligned to the values of the participants, they did not fully counter the misinformation fueling hesitancy. So, my biggest takeaway was that, or this gap highlighted that there is a need to combine cultural competence with scientific education if we actually want to address community specific barriers in health equity research, and if we want to bridge the gap between healthcare access in underserved communities. So, yes, these were my key takeaways, and this was my presentation. I am very much grateful to Dr. Rabin, Dr. Stadnik, and my wonderful team, Carrie, Kelly, Kara, Andrea, and everyone else who helped me out and supported me in this journey. Thank you so much.
That was wonderful. Thank you, Hesti. And now I'll pass it to our last speaker, Isaac.
Hi, everyone. We just set up the slides really quick, and we should be good to go. Not that one. These. All right. Can you all see the slides nicely? All right. So, yeah, so I'm Isaac Bouchard, and today I'm going to be talking a little bit about the reflections that I've gathered through working on Attain Nav that has been led by Dr. Nicole Stadnik. So let's just jump into it. So my research journey started when I was an undergraduate at UCSB. At the time, I was working at the Undocumented Student Services Center, and I was also working as a peer mentor for undocumented undergraduate students. And through that, I learned about the barriers to care that this population face when accessing mental health services. And so during my undergrad, I led my first qualitative study examining the barriers and the facilitators to mental health care for undocumented college students and their families. And after learning about these barriers, I was starting to wonder how I can make a real change as a researcher and how I can actually improve the settings that support these populations. And so that led me to joining the DISC, where I could learn more about implementation science and translational science. And then soon after joining, I started my master's in clinical psychology at CSUN. And so my work in my master's and the DISC at the same time have really culminated into my current program of research, which I'll be talking a little bit more about later. So yeah. Oh, and now I'm applying to doctoral programs in public health too. So for Attain Nav, the big central issue that we're trying to address here is that youth with autism face high rates of co-occurring mental health needs and also need to navigate multi-level barriers to appropriate care. And that includes fragmented healthcare systems, a shortage of specialized mental health providers, language barriers, among others. And so Attain tried to address this by having a mental health screening and referral process for autistic youth within pediatric primary care. But there was a need for additional caregiver guidance and tailored implementation support for these organizations. And so what Attain Nav did is I made a little arrow thing, is that they added an adaptive family navigation component to it. And so the three aims that made up Attain Nav is to first adapt family navigation for school-age autistic children with mental health needs, and to then develop family navigation health technology tools to enhance Attain Nav, and then to test Attain Nav within pediatric primary care. And so the main components or the overarching goal of Attain Nav is to promote engagement with health and community services by having lay healthcare navigators deliver Attain Nav over a span of 4 months. And some of their primary responsibilities comprise of collaborative goal development, motivational interviewing, and problem solving strategies with caregivers. So for the methods and DNI frameworks, so the Frame S was a central DNI framework that was used for all the aims, but for aims 1 and 2 specifically, it helped us develop the interview guides. So the Frame S is a framework that essentially allows us to systematically document adaptations to interventions and their implementation strategies. And so after we developed our interview guides, we then interviewed caregivers of autistic children, pediatricians, clinicians, and health informaticists, informatics. And then once we conducted our interviews, we then analyzed the interviews through rapid qualitative assessment to identify adaptation themes. And so for aim 3, we bear with me for this one. So we did a modified cluster randomized stepped wedge hybrid type 1 effectiveness implementation design. And so that allowed us to test Attain Nav within pediatric primary care settings and to measure the clinical outcomes while also gathering information on implementation outcomes. So significance. So 56 out of the 65 families that we contacted enrolled and completed Attain Nav, and caregivers reported high satisfaction with family navigation services. And so the study showed the potential for family navigation to reduce barriers to mental health care and by facilitating the time it takes to reach to the first mental health appointment and by also connecting families to effective resources, including community resources and autism-specific services. And findings also offer a guidance for healthcare policy to consider community-driven approaches and case management strategies, and also including non-traditional lay navigators within these organizations to facilitate continuity of care. And the study also provides a model to incorporate community engaged perspectives within intervention work and adaptation work to better increase fit within these settings. And so there were two main outputs that came out of this project. So the first one was the paper that outlined our adaptation work, which is the one I was lucky enough to lead and report on. And so essentially, I tracked and I evaluated the adaptations made to family navigation using the Frame S. And I also was able to lead the paper and present at CopperCon for the results. And I also helped with the main outcomes portion of the project. So for data collection, I was able to meet with physicians and caregivers to collect data on their experiences with family navigation. And for data analysis, I helped run simple descriptive stats. And I also was able to help with the manuscript for the main outcomes paper. So to zoom in a little bit into the adaptation work that I was able to lead. So we first developed an adaptation tracking database that was created to include relevant Frame S components. And so the components that we adopted from Frame S allowed us to characterize the type, the rationale, the source, the timing, and the outcome of the adaptations. And we then developed an adaptations team. And so that included Dr. Nicole Stadnick, the navigators, me, and a project manager. And then we then sent weekly emails to the larger research team and the partners from the participating healthcare organization to identify emergent adaptations. And then these adaptations were then discussed during our weekly meetings. And then we also did think aloud exercises to help evaluate the perceived impact of those adaptations until we reach consensus. And so you can see here that most of the adaptations had positive impacts on the implementation of AttainNav. And most of the adaptations were related to maintaining the feasibility and the acceptability of the study procedures, increasing family recruitment or engagement, and increasing the acceptability of the intervention components. So this is how the project influenced my program of research. So I'm very much interested in increasing access to evidence-based mental health care for undocumented and newcomer youth and families. And I hope to do so by implementing and adapting these integrated care strategies, including case management and mobile health, within primary points of care that serve these populations. I'm also interested in incorporating lay healthcare workers or lay health navigators to further promote continuity of care and to evaluate digital health tools to facilitate continuity of care in these settings. And I am coming from clinical psychology, and this kind of made me consider public health as a way for me to look through research questions through a more population health perspective, and yeah, working with healthcare professionals. So the main takeaways that I got from this project was that integrated care strategies offer an important path to address barriers to care among a variety of underserved populations. And these organizations would benefit from community engaged practices and incorporating lay navigators or other case management strategies to promote engagement with mental health care. And we should further evaluate digital health tools, specifically within community settings that serve these populations. And a little quick acknowledgements to all the wonderful people who have been able to make this happen. Dr. Nicole Stanek, Kara Swanson, Dr. Borshka Rabin, Kelly Kane, and Carrie Jeremiah. And that is it. Thanks, y'all.
Thank you so much, Isaac. And thank you to Hesty and Rosina for such wonderful presentations. I felt like they were incredibly insightful and spanned across a variety of different topics. So it's really great to hear about your experiences and what you've learned from these projects. I'd like to open it up to questions. If anyone wants to unmute themselves or put a question or comment in the chat, feel free.
I don't want to dominate because I already had my words, but I do have a question for Isaac. Isaac, you did a beautiful job describing the impact of this work on your own planned research. So I wanted to celebrate that. And I also just wanted to say everyone else did an incredible job summarizing your rich learnings. Specifically with the adaptation documentation, you might know that I am very interested and excited about it. Would you mind to tell us how you decided whether something was positive, neutral, or negative impact? What
Yeah,
was your
that's
Mhm.
Yeah, so as a group, we developed this adaptations team. And then so we each on our own evaluated or looked at the adaptations and discussed how we felt impacted the implementation and the overall feasibility of the intervention within that setting. And then we met and we discussed how we each individually believe the adaptation had an impact. And then whenever there was an argument or a disagreement with what we thought, we eventually had to talk about it until we reached consensus. I felt it was pretty similar as to a thematic analysis for qualitative research, where we had to have these open discussions until we reached consensus on these outcomes. Yeah.
Thank you so much. I will keep asking questions because I want to ask actually one question from Hiti and one from Rosamina, but please others, I just want to really encourage you to use the chat or unmute and come on and ask questions from our amazing presenters. Hitzi, I will start with you, if I may. Thank you so much for all your great contributions. I will continue on the theme of adaptations. And, I know that you set up our REDCap database and started to list some adaptations that happened. What was your experience with thinking about adaptations in this project, generally, and more specifically, what kind of challenges do you see in documenting adaptations in projects?
Sure. Thank you so much for your appreciation and encouragement, Dr. Rabin. So one thing that I noted while, just like entering the data adaptations in the REDCap is you actually have to use your mind from all the angles and decide whether this is like a good adaptation or a bad one, like whether it would, what domain of the framework that you are actually using in your project, what domain would it affect, how can it improve. So for our project Weave, we are using two frameworks, one is Prism and one is Re-aim. We are using Re-aim to evaluate the outcome. So it is important to think from that insight, like how are you going to if this particular adaptation, will it help to increase the reach or whatever. You have to think from that all the angles. And then another challenge is that there were, most of them we had planned adaptations, but when we had unplanned adaptations, like we had SYH transition from one electronic healthcare record system to another one, and we were kind of confused between for one of the parameters. So I think in that cases, it would have been better if there were some kind of technology protocol, like technology change protocol, put into the place, so everyone is on the same page and we are not losing data, or we are just not confused with the participants who are there in the study. So I know like that would be that is something off track, but yeah, you have to think when you're documenting adaptations, you have to think from all the angles. You have to think which framework you have to use. And you and Dr. Stadnik and everyone, you really helped me outline what all things we could include when we are thinking about potential adaptations. So yeah, that was my learning.
Super. Thank you so much, Hitzi. I am going to finish my round, so perhaps others will have questions by then. Rosamina, I'm going to step out there and kind of remind myself that you also worked on the G11. Is that correct, with Dr. Ahrens?
Yes, I did, but very shortly. There were technical difficulties with my access, but yes, I think Dr. Ahrens was specifically very encouraging and for me to get involved in global health implementation science, and that was definitely the project that initiated that interest.
Did you get a little bit of a sense what that project was about?
Yeah, I mean, we specifically mostly worked on the IRB for it. It's been a few months now, so I don't remember the specifics.
Very good. So I think that one of the things that we are trying to do in the internship program is to expose our interns to different projects. And then sometimes some projects stick better than others in terms of with their interest. It sounds like, Rosamina, it was mostly technical why you were not able to continue. But I always get excited when we find a good match where the project aligns with our interns' specific professional interest.
Yeah, definitely. I think the latest project that I was on with you and Dr. Statnik was the HIV project, and I think that was a great application of my knowledge. So yeah.
That was a review that HITS is also part of, where we are trying to identify implementation science and HIV theory model and framework applications. So that's another one. Any other questions from our audience? I realize this is a few days before the holidays and it's a late afternoon. So I will be quiet for a little bit, just in case someone is just getting ready to unmute or type a question.
I have a question. So Rosmina, you helped with the, we call it the dish course, but I wanted to hear a little bit more about what, because you had both that like observation role as the TA, but you were also kind of involved in like it was almost like you were an observer of the course or an auditor as well. And so in your MPH courses and in your work in Iran, how did, did any of those things kind of carry over? Did it, may have changed your experience in your grad program or in your own research? Because I think that course is fairly interesting, where you're really writing a grant application. And I know you do have experience with writing grant applications. So between, before you started the course and then now in your present, like where you're at right now, could you talk about, maybe the things that influenced you, or has anything changed?
Yeah, I think I touched on this a little bit, but in terms of like kind of the discourse not only being an introduction, and being a great way to introduce different people to implementation science, it was also a great opportunity to kind of see the different application of implementation science and the different fields that it goes into. And I think my experience in grad school kind of highlights that, which in my opinion, implementation science is just an opportunity to take a step back and to kind of analyze, one, where do you want this project to go? To how long do you want it to be there? What is the impact that you want to make? And I think the different frameworks that we touched on in the discourse, which I know that it is still happening. So if any of you ever have the opportunity to enroll in it, I would definitely encourage you to. But just to kind of take the step back to analyze that. And in terms of like grant writing, obviously, and during the course, I didn't have the opportunity to actually write one. I had to learn that through my master's program, but it was definitely insightful to see the amount of detail that the students put into it and the questions that everybody had about it. And that obviously translated into me just learning more. And I think that is what the internship was about. And in terms of my own projects, my Iran project is actually translated to a remote project, which is something that was discussed a lot during the course. The power of being remote and still being able to do it is putting into kind of frameworks and also step by step and being present while still not being there. And the project that I worked on with Dr. Aaron's kind of highlighted that, as I was able to like sit into the interviews and learn about something that even none of us were there to experience, and to kind of take a step back and to listen, and not just be kind of, I guess, shoving down the frameworks to people, but being able to listen and to actually apply it. So those were just kind of experiences that made me go into research a bit more.
Cool.
Well, this was just fun to listen to these presentations, your reflections, and I hope that we get to work with you for the next several months, potentially years. But I also know that many of you will be moving on to the next career stage. So I just wanted to thank you, all three of you, for the contributions, for sharing these with us, and look forward to learning more as we advance these projects. To our audience, thank you for being here with us at the DISC InStep seminar series this year, and we look forward to next year more fun activities. So thanks everyone, happy holidays, and Kara, I don't know if you have any closing words or message.
Yeah, I just want to say happy holidays, everyone. If you have a chance, please complete our brief seminar evaluation. Gives us an idea of how we can improve. But thank you so much for joining. I'm really glad that we were able to hear from our student interns and hear about the different work that they're doing. So I'll let you guys go. Happy holidays.
Thank you, everyone. Bye.